travelers inbound to Guam, and we wanted to bring on I like calling him Dr. Doom from the Governor's Physicians Advisory Group. That's actually a compliment, Doc.
Okay.
Dr. Felix Cabrera. Doc, good morning. Thanks for joining us.
Good morning, Chris. Good morning, Berg. Good morning, Jason.
Good morning.
I mean, you were the guy that they go to, like Mr. Presentation, and so you had your time to shine. The press conference Saturday, where it really looks like the Physicians Advisory Council worked hard on revising, right? Because it's not a rollback, revising these quarantine procedures, and this was all relative to the surge that we saw last week. So, Doc, we'll go ahead and give you the floor. If you could just talk about the conversation that went into changing these protocols.
Yeah, sure. To be honest, this has actually been a process probably in the past 2 weeks or so that we've been working towards. And, it started, of course, with trying to understand how to safely reopen tourism based on the trends of the cases that we were seeing at the time, and how we can actually make this possible. So there was a lot of work in that. But then in order to do that, that meant that was going to affect how we were, performing our quarantine and testing and isolation and tracing program overall. Now, that being said, we were moving toward, we actually had a pretty good proposal, and a lot of the work was put into that. And then we started having these increased cases of not just within DOD, but then also within the community, especially at the end of last week. And so that changed everything overall. And then we felt that there was more urgency in implementing the other part, which is the high risk areas and medium risk areas, for example. And how do we implement that part of the quarantine program right away? And so that's where the shift really went into in the work, probably the 48 hours prior to Saturday's press conference. And so the focus was more on that part, and so that's where we are today.
Mm-hmm. Why did we shift from hotspot to high risk designation?
Well, one of the important things was to understand why we were making the changes, and everything is, we say this multiple times, that everything is risk versus benefit, and so let's actually just focus on what we're actually talking about, the risk. And when we talk about quarantining, people traveling into Guam, it's about the risk of what is, their chance of bringing in new coronavirus to the island. And so we said, let's focus on that, and let's not, focus so much on the buzzword of a hotspot. And so by actually calculating a risk score for this area, then we make it more objective. And it's something that can, if ever challenged in court, can hopefully stand up in the court of law, that we were using objective measures to name these particular locations. And part of the call was that saying, hey, how come we're doing this for some areas, but then the whole country looks like a hotspot in and of itself, but it's more complicated than that. Mm-hmm. And so we had to look at things state by state level. We looked at it even county by county, but then that became too granular and actually was becoming even more unfair how we would risk stratify them. So we settled on just looking at just the states themselves. Mm-hmm. And I think that was the more uniform data that was coming out from at the state level that we could trust and that we can use it and make a better assessment with.
Mm-hmm. Can you explain the change also in the new quarantine protocol for the 72-hour PCR pre-arrival test? And, before, I don't think it was a PCR test, because the PCR is the blood test, right?
No, the PCR is the nasal swab.
It's the nasal swab. So,
yeah.
Serology, that's right.
Serology is the
right,
blood
the blood test, right?
Yes. And so the key thing, again, PCR tells you about active disease, where serology only makes an inference on past disease or potentially more recent disease. So PCR is always the standard that we look at in terms of if we're trying to understand somebody's risk of actually having active disease. And so,
right.
So that's the part there.
Okay, and so if you could just kind of break that down, what's going to happen for anybody that arrives after midnight on July 1st?
Yeah, and so basically, the first question is, are you originating from a COVID-19 high-risk area? An area that's listed. And if you are not, then you automatically go into home/self-quarantine. And so just to be clear, everybody goes into quarantine when you arrive. The question is just where do you undergo your quarantine? So if you're not coming from a high-risk area, you get to quarantine at home. If you are coming from a high-risk area, then the next question is, have you had a negative PCR test less than 72 hours prior to arriving on Guam? If you have, then that means your risk is now decreased overall. And so then therefore we feel it's safe that you can also quarantine at home. But if you don't have this test done and you're coming from a high-risk area, then the way that we mitigate that risk is that we actually hold you in a government facility quarantine. And so that's where the risk mitigation part comes in. Now, here's the part of I think that some people may be confused about, but I want to make sure it's clear is that, again, wherever you're quarantining, either home or in a government facility, in either situation, you do have the opportunity to test with another post-arrival PCR test and to see if you qualify for an early quarantine release. Again, another step in risk stratifying traveler coming in.
Right.
So if you've had this negative test before you came in, and then you can actually retest on day 7. And then if you don't have that test at all, then we give you the option on day 10 to test. And again, this is subject to testing availability, which is a whole different concern. But say you have that negative test post-arrival, then we feel comfortable enough to let you release from quarantine. That means even at home. That means you're not restricted at home anymore. You can go about. But everybody must fully comply with the 14 days of symptom monitoring and tracking with public health. And so that's a program that's part of that, where you have to check in daily and ensure that there's no new developments. Mm-hmm. But we also have a pathway that if somebody doesn't want to get tested, they refuse to get tested, either pre-arrival or post-arrival, then that's fine. That's your right. You don't have to be tested, but you do have to finish the full 14-day quarantine, either at a government facility or at home, depending on where you started out at.
Doc, will public health still be able to grant quarantine exemptions for essential workers or for residents with hardship circumstances?
So I want to be clear about that. So just to be clear, nobody is granted exemption from quarantine per se. What they are granted is restriction of movement ability, so that if you are here for an essential purpose or here for a hardship, that you can qualify for restriction of movement where you are allowed to go to where you need to go, but then you still have to come right back to your place of quarantine. And so that needs to be the clear part there, that you're not, if you're on quarantine, you're not to be anywhere else, aside from your house or your place of business or the place that you need to go to. That's part of the reason that you're essential or you're here for the hardship.
Doc, I don't know why I almost keep calling you Gov, but Doc, let's say that, Guam is small, right? Let's say we know somebody just got back on island and they're out, at the grocery store, out getting coffee, and the day and age of social media, you can kind of keep track of who was here, who wasn't. So in the event people see this and they kind of wonder, like, hey, is this person supposed to be on quarantine or lockdown or what? What is there, like a snitch line or something they can call?
Well, I don't know to that detail.
Because you recommend that people do their part, because
absolutely. And the thing is that that's the other thing that the physician advisory group has been really advocating was the enforcement of these fines that are right now in law. And that if you violate your quarantine, then it's $1,000 fine. And that's, there's a reason why that's there. It's because you're putting the public at risk. You are endangering the public when you violate your quarantine orders. And so that's the key thing there. And Hawaii's had no problem making examples of certain people who break these quarantine rules. And so, in our conversations with public health as well as with the Attorney General, we say that, hey, this needs to be serious, and people need to take this extremely seriously. If you're in quarantine, it's not just they're not really watching me, at home. I can sneak out and go. So you are seriously putting the public at risk, at that point. And because of that, just like if you're driving home drunk, that we have no problem arresting you and no problem putting you in jail in that situation and potentially getting fined. But in this case, we should treat it in a similar fashion. And that's I know it sounds harsh, but this is serious. People's lives are at risk.
Right. Doc, just for clarification, this 72-hour pre-arrival PCR test, it's not a requirement for people who are coming in. It's just that if you take it, it just determines whether or not you're going into a government quarantine facility or home
Yes,
quarantine.
and so it serves two purposes. One is that it can, if you're coming from a high risk area, it determines whether where you might quarantine. But it also serves in potentially getting out of quarantine earlier. Again, so it qualifies you to get that 7-day test post arrival. And so because of that, there's two incentives to potentially get it, and we highly recommend that people get it before coming. And one, for your own peace of mind, but number two, for our peace of mind, and that you are now at a lower risk. Now, it's not perfect. There's still a chance that you may have it. So that's why there's all these other, there's a variety of safety nets put in place to try and reduce that risk.
We talked to Dr. Nguyen last week about this possibility of testing out of quarantine. Can you confirm or re-verify that the cost for that testing out, it's going to be borne upon the person on quarantine?
So that, I think, part right now as it is that I don't think there's a final decision on that part yet. And right now, until stated otherwise, it's on the shoulders of us, of the government. And so until it's specified further, and that I think is going to have to do with the resources. We have a fair amount of resources, and we can actually do these tests. I don't think there's going to be any pressure to start charging. But if all of a sudden the demand really goes high and everybody wants this, day 7 or day 10 test, then that may have to change, and then there may have to be a nominal fee that goes with that. For example, in the CNMI, when they were doing this, I think it was around $50 to get this the post-arrival test to test out of quarantine. And so, if anything, I think it would be subsidized, but it's not it's not something that insurance is going to cover. I think that's something that's clear if they're asymptomatic, because this is serving a different purpose overall.
I had a question from one of our viewers. It is the summertime, and we're going to see a lot of kids out there. One of the questions is kids camps or practices safe for kids to do right now or in the next couple weeks with the spikes? I know other people are doing camps right now.
Yeah, so they have to adhere to a pretty high standard in order to run these camps, and in a similar way that schools will have to be run in some ways. And so with these extra precautions, I think that risk is actually pretty it's pretty similar to just going to the park, for example, going to the beach and on a Sunday. So I think you're getting to that certain level of risk. So I wouldn't I don't think that the numbers as we're seeing them now, warrants us to really clamp back down. We're not going back to P-Core 1, at this point in time. There's nothing that's telling us to do that. So I would say that as long as that plan is in place and it's something that public health is okay with, then really, I think people should not be fearful of moving, especially kids. I think kids are, thank God that they're in a different risk category overall, and that their chance of spreading it to each other and really getting sick from it is much lower than the adult population.
Right, and I think it was Dr. He was on our show a couple weeks ago, and when we were talking about this pilot project with the Japanese school,
yes.
And he was mentioning how based on their research with, I guess Dr. Berg was also a part of this, that children weren't believed to be super spreaders or something like that.
Yeah. So that's right now what we're seeing, and I saw some during our last PAG meeting, they were showing some video on the slides of how that pilot program's going on, and it looks great, and it looks they're really doing well with that overall, and I think it serves as a good model for other schools and programs.
Have you guys had any discussions or concerns about what's happening with the Department of Corrections with the 2 positive cases, and then we just heard about the positive case with the police officer over at the Dededo precinct?
Yeah, so of course, that's a population that we're, that we be very concerned about in terms of the DOC prisoners, and the key part again is that that's a very closed system, and it's not distancing there is not the easiest thing to go about, and it is a major concern, and that's what we're seeing in a lot of parts of the country, that these are where a lot of the major outbreaks are happening, and these and the parts of risk mitigating them is takes on a whole different level of complexity. So we haven't looked at, we haven't had a report from public health in terms of how that is evolving, and so, but once they do enough of their testing and contact tracing, I think that we'll get a better picture.
We do have another.
Yeah, I got it here. If a family member of mine traveling from Philippines having a negative test within 72 hours, he or she can quarantine at home?
Correct.
Okay. And then what I got, my son is in Oregon, Doc, and I just saw you guys have designated Oregon as a high-risk area. So what does he need to do to come back and go home?
Well, if he wants to come back home, he can do nothing different and come home and go into government facility quarantine. That's technically an option, but then the ideal situation is that he does also try and get a negative PCR test done within 72 hours prior to traveling, and so that he can have the comfort of quarantining at home, and then instead of getting stir crazy for more than 7 days, then then be able to test out on after day 7.
Doc, so when my son, let's say whatever, he goes home, he's in the home quarantine, is he allowed to go out and get coffee or go to the grocery store or go running or
Absolutely
anything?
not. Zero.
Can you say that again? What are you allowed to do when you're on home quarantine in terms of leaving your house?
You're allowed to stay home. And that's really it. That's what home quarantine is. The only time that there's any exception to that is the special circumstances that were discussed if you applied for because you're an essential worker or because you're here for a specific hardship. And then even those times that you leave the home during quarantine it has to be very specific to that, and that has to be reported to public health, and as part of the communication line. And so if you're not here for any of those reasons, quarantine is quarantine. You stay home. And in fact, we recommend additional layer of protection that those within the same home also have some sort of measures within the home to isolate as best as possible.
Okay, that's good to know, because my connect to public health is retired.
That's it, though, right? And take the end of this week.
That's it. I got to make a new connect. Thanks, Linda. Just kidding.
Yeah.
What's your take on that, Doc? I just got to ask. Are we driving the car? Are we okay with someone else behind the wheel? What do you got to say?
I think we're okay. I think everything is the communication line has been there. The knowledge base has been there in terms of that's why it's important to have deputy directors. That's why it's important to have other people lead different parts of this. And so so in us working with the rest of the team, I think there's a good continuity with this. And so Linda's going to be greatly missed, and she's been tremendous in this process, and Guam owes a tremendous debt of gratitude to her, particularly for standing up during this crisis and doing what she's done. And there's so many things that we'll never understand what she's gone through and been able to do for us. And so she's a hero in my eyes, and I think that we all should look at her in the same way.
Right. We miss you, Linda.
Yeah. And so the other thing I just want, just real quick, last thing, again, is just to understand that, the Physician Advisory Group, we're very sensitive to the needs of the island in terms of the tourist economy. And so it was not an easy recommendation to say to hold off on the tourism part right now, and that we are still looking at it very, very closely. And in fact, we already have a plan in place in terms of how this quarantine part may evolve towards once we open up. And I know former Governor Gutierrez mentioned about July 15, and I think that's okay to look at that date. Let's give something to look at.
I mean, is that what they're looking at? Is that what you're telling us, Doc?
No, that's what I just learned that from the call
From-
earlier.
Okay.
Yeah, and from what he said during as I was listening, and
Yeah.
and that he said let's shoot for July 15th. So like, great, that's fine. That's 2 weeks later. I think there's time for us to look at that and let's see what that means in terms of data. And the past 2 days have been reassuring. And so we'll take it from there. And so, let's always first, have a date to look at, and then, if it doesn't look reasonable, then we won't do it. But if it does, then, why would we not look at it that, as early as 2
Right.
weeks? And I think that's fair.
Can you tell us anything else about these airmen, Duck?
I don't have anything else to share, I think, than what's been exhaustively shared already.
Okay.
With it, and so, again, it's just one of the last point, I'll just make is that what's the concern really is these non-cluster positives that we see.
Right.
And again, if you see 15 or so in one day, and if there's no connection that's obvious, then that's 15 potential clusters. And that's where that, the alarm really sounds up and sounds off, and we have to do something different at that point. And so, but again, the reassuring part is that at the same time that we see these uptick in positives, that we don't see an uptick in hospitalization. And so when you see that together, then that means the system is working. That means we're catching cases early. I mean, we're catching them in a situation that's not more harmful, where these positives probably would have just become undetected for a long time until we started seeing high hospitalizations. Right. And so because we're seeing that early, I think that this is a good sign that we're putting things into our measures in place to prevent it.
Doc, is one of the, factors in terms of moving us from PCOR, moving between PCOR levels, having a robust contact tracing, effort? And,
that's one.
And considering the fact that we had seen this spike of 16, do we really have enough contact tracers to do all of these investigations?
Yeah, as of right now, we do. I can definitely say with confidence that we do, and it's a fraction of and the cases that have to be contact tracing is only a fraction of what we had to deal with back in March and April. So I want to remind everyone of that. So our capacity to do adequate contact tracing is even more robust than it was back then. And so with the different personnel that have been included into part of the efforts overall, and there are different levels of contact tracing also, where there's the really high risk ones, the medium, and of the low people, and so the more experienced people, the more clinical savvy persons, they go toward the more higher risk contact tracing efforts, and so it's actually more sophisticated than it was back then, and even back then it was successful. And so I think we should be comfortable with things as it is right now.
Doc, we had a comment here. Tell Dr. Cabrera that the home quarantine instructions state you can go get essential groceries or takeout. I questioned that, but was instructed to just inform public health whenever I left for takeout or grocery shopping for essential items.
Interesting. Okay. Yeah. So, the thing that
kind of seems to fly in the face of what the home quarantine is supposed to be about.
Exactly, and that has to be the absolute last resort. Like you have no other option, because the intent is that everybody should have a means of somebody else helping them do that. And then this is where we have to come through for as an island, as to how do we help our friends, our families that need help, that who are in quarantine, and that we deliver them the essentials that they need, and that they don't come out. And so that has to be very, we have to take that very seriously. And I don't know how that's actually allowed it. Again,
I'm going to ask Linda. Oh wait, no, I'm not.
Yeah, and so getting takeout, there's delivery. There's so many other alternate options to this, and so there's just no there's just no excuse. If Payless started to deliver, then maybe that's a whole different thing. So maybe they should look into that.
Right.
No, you're right, because you see the people that are at the government facilities. I mean, we've got National Guard, we got people standing outside.
They can't go out on a grocery.
Yeah.
All right, Doc. Well, thanks for that. Appreciate it.
No problem.
Anything else you wanted to get out? I know we're going into a holiday weekend.
Right.
Yeah.
Let me get in here real quick. We're KUAM FM, Agatnia, Guam. Good morning to our KUAM TV 11 viewers on KUAM TV 11. Good morning. It's the KUAM News Takeover, Guam's favorite, containing COVID. On the line, we have from the Physicians Advisory group, Dr. Felix Cabrera, and he was just asked by our Sabrina Salas Matanani his thoughts on the upcoming 4th of July weekend and what we need to do to mitigate the risk of spreading COVID-19. Doc?
Well, yeah, thanks, Chris. And so what I'd like to say, first of all, is that, we have to, even before thinking about the weekend, and it's that to understand that your baseline healthcare needs are very, very important, and they actually are the parts that's going to ensure that we really avoid what we're really most afraid of, which is increased hospitalizations at GMH because of COVID-19. And, we can be fearful of the spread of the virus, but we have to be the most fearful of what it means to our infrastructure, our hospital infrastructure. So because of that, I really recommend people for 4th of July, use it as a time to get more healthy. Use it as a time to get more exercise, to eat better, and to follow the precautions that we've shared, which is washing your hands, still wearing your mask when you go outside, when you go into public, as best as you can, even when you're in the beaches and parks. But understanding that the highest risk is when you're indoors, and that you really should be wearing your mask if you're in indoor public space. And then don't forget about, again, washing your hands frequently. Carry a small bottle of hand sanitizer if you can, and do it frequently. And every time you touch a door, think of that as a reminder to sanitize your hands. And so I really recommend that everybody do that. Take care of your baseline health, because that's the most important part in terms of us getting through all this.
All right.
Thanks,
Thank you, Doc.
Okay, thank you.
Wash your hands.
Is
Is there a press conference today?
Not that I know of yet.
Okay, all right.
We usually have our 8:30 meeting with the governor every morning, and so a lot of times those decisions are made during that time period.
Okay,
but I'm not foreseeing one.
A second question, or last question, are you resigning or retiring?
It's hard to resign when everything I've been doing is volunteer.
Volunteer or voluntold?
A little bit of both. Yeah.
All right.
Well, thank you so much for what you're doing, though.
Yeah, appreciate it, Doc.
So we have a great team, and the team is a volunteer team with the physician advisory group.
Right,
I want to make that
right,
clear as
yeah.
well. And so we everyone here has been working very hard, for Guam and for ourselves also, because we live on Guam and Guam's our home.
Amen.
We hear you.
All right, wash your hands.
All right, take care.
Okay,
I will.
take care.
Yeah.
Okay, bye-bye.
One of my friends just texted me, Uncle Carl should have his own press conference. More exciting. That would be great, huh?
Oh, man.
He should. He doesn't need to ask anybody. He's Carl Gutierrez. Like, I don't even think he needs to ask anybody to solve the homeless problem. Just go do it, dude. Hey, what's that saying about asking permission and forgiveness? Pretty sure you're not going to have to ask for forgiveness if you solve the homeless problem. Might get you a medal. It's 8:08. We're going to do news, and then we've got public health, Tess Archangel, to kind of talk about some of the numbers coming out from public health in terms of assistance. And Major Anton Uggan will go behind bars where they have had 2 COVID-19 positive cases with the officers at DOC. So we'll talk about that coming up right here on the KUAM News Takeover, Guam's favorite. It's containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671.